Hey guys, it's Dr. Ivy Branin here, expert in women's health and hormones. And today I'm actually going to be answering one of the questions a patient of mine recently had in regards to her son, who is 8 months old, and she wanted to know what I recommended as far as vitamin D or D3 supplementation for infants and newborns. And if this is your first time watching one of our videos or many times, definitely do not forget to subscribe to the YouTube channel. Also feel free, if you like the video, don't forget to like it. And anything that I'm recommending today, you should be able to get through full script by simply clicking on the link in the description of this video. And if it's your first order, you will receive 10% off your first supplement order. So what exactly is vitamin D, or maybe you're just thinking D3? So vitamin D is a fat-soluble vitamin, so it means that we actually store it in our body, unlike water-soluble vitamins, which we readily excrete. It was also sometimes considered almost as if it is a hormone. The D3, or vitamin D3, is actually the more active form of vitamin D. It's also called cholecalciferol. And then there's also D2, which is the less active form. Vitamin D is essential for bones, basically bone mineralization, as it helps with calcium. It's also vital for proper immune system. It also helps with any kind of connective tissue, specifically skin. And something that I often will find in my practice is that low levels of vitamin D could be associated with eczema. It also could even be associated with different vaginal dysfunctions, again because of its relationship to connective tissue. Vitamin D is also really essential for brain, cognition, mood, and also fertility. One of the big concerns, though, specifically with vitamin D and young children, is rickets, which is a bone malformation. It's not very common, but again, there is a risk factor, specifically if vitamin D levels are low. So who needs vitamin D? So I would say we always need vitamin D. Now and I think specifically who needs vitamin D supplementation. So a couple things. Yes, most of us do get our vitamin D naturally from the sun, but most of us live too far from the equator that for the most part, most of the year, basically outside of towards the end of May, towards the end of September, we're really not getting that much vitamin D from the sun. And if you're wearing sunscreen, that also reduces the amount of vitamin D that you'll be naturally absorbing, about 95%. There also are some food sources, but it is pretty much limited to salmon, cod. That's why cod liver oil actually is naturally high in vitamin D. Sardines, so a lot of our seafoods can have a good amount of vitamin D, but many of us will have to supplement. In my practice, I base my supplementation on blood levels to determine, because again, it is a fat-soluble vitamin, meaning we do store it, and too much is too much and would not be helpful. So I base on my practice on blood levels. Now, more specifically, because we're talking about infant supplementation, so most infants will need about 400 IUs daily of vitamin D. Most infants, because of, we don't want them getting sunburn, they're not getting a lot of sun exposure. So that's one thing. They also, from their diet, most likely are not getting enough vitamin D. So, for example, a breastfed infant, even in the best circumstances where the mother has very high robust vitamin D levels, is getting anywhere from 5 to 80 IUs per liter, which could equate to, again, anywhere from 10 to maybe 160 IUs a day, which is not meeting the requirement for vitamin D. Now, definitely you want to be careful if you are formula feeding your infant to read the label and seeing how much vitamin D is in your formula. You may or may not have to actually supplement with vitamin D if there is enough vitamin D already in your formula. And again, you don't want to be going over 400 IUs. So what is my recommendation for vitamin D? What product do I recommend? What do I actually use with my son? So I really like the one by Carlson. It's their Carlson Labs Baby Super Daily D3 drops. So I like the drops because it's only one drop. It's very simple, very easy to administer. The other thing I like about these drops is they are suitable for vegetarians, vegans, and people that are kosher. So wide spectrum of uses, and it's pretty simple. And so that would be what I would recommend for vitamin D for infants. And you can easily find the Carlson drops by simply clicking on the link in the description of this video. If this is your first order with FullScript, you will receive 10% off that order. Also, don't forget to subscribe to our YouTube channel. And if you liked today's video, don't forget to like it. Of course, drop a comment or question in the chat. I'm happy to answer it. And I do have an announcement, or something I'm very excited about, is that we are launching an e-course, our first e-course, and it's all about getting pregnant in your 40s. So I was a woman who got pregnant in her 40s. I've also helped other patients get pregnant in their 40s. We have a lot of videos already supporting that, but if you want to go deeper and you are somebody who is wanting to get pregnant in your 40s, or even somebody maybe who's having difficulty getting pregnant, or you know someone, definitely want to make sure that you are subscribing to the YouTube channel so you won't miss the launch. And I'm so excited to share all that information with you. Anyway, hopefully you found this video helpful. Again, this is Dr. Ivy Branin, Naturopathic Doctor. Looking forward to seeing you next time.